Hello, Mister. My name is Clever Waman. My topic is multiple mucosal neurona. Definition: a benign tumor of nerve tissue commonly found on the tongue, lips, or in the gastrointestinal tract. Mucosal neurons are a characteristic feature of multiple endocrine neoplasia types 2B. Isocanon is mean 3, which is hereditary syndrome associated with the development of medullary thyroid cancer. The video.
I'm Casey Tamanik, and I have what's called mucosal neuroma, and it is a syndrome that causes extra bone growth and extra growth of cells on different parts of my body.
Hi, I'm Sarah Strop, and I am Casey Tamanik's mom. When he was 2, he started growing some extra cells on the left side of his tongue. We had 4 different specialists look at him throughout Denver, and they really never could figure out what was going on and why the extra production was there. He has had many medical conditions since the day he was born, but the one that has had the most scare throughout his lifetime, he was finally diagnosed when he was 11. We started trying to figure out what was different about him when he was probably about 2 years old.
I have like extra cells in my lip, and it makes it a little bit more enlarged than the other side of my face. I also have like some bumps on my tongue that don't affect me really, but it's just extra growth. I've had multiple surgeries because of my mucosal neuroma. I've had 2 different tongue surgeries. On the first one, they lasered off the full top of my tongue, and then on my second surgery, they cut off a third of the left side of my tongue. I've also had ear reconstruction surgery on the left side. I have traveled everywhere from Denver to the Mayo's Clinic in Minnesota.
The report came back saying that he had MINS 2B, which is multiple endocrine neoplasia type 2B, with mucosal neuroma. They gave us 3 days to get to Minnesota to be able to have the doctors there do more research on Casey's condition.
There was periods of time when I had to wait to find out if I had cancer or other types of syndromes.
When we got to Minnesota, we had very good news because they diagnosed him with only the mucosal neuroma, which at that point in time, which was 10 years ago, he was one of 5 people that had been diagnosed with only the mucosal neuroma. However, it was a little bit different to think that you had a child that there was 1 in 5 people in the world that had been diagnosed at that point in time. Casey has brought so much joy into the world, and we are thankful for every day that we have with him, and realize that
Yes. Pros and cons. The most common clinical features of MIN2B are 1. A tilting marathon body builds in which long bones are disproportionately enlarged. Masses beneath mucosal surface in the mouth, lips, and eyes discussed below. Low muscular mass somatics is more myopia. Gastrointestinal complaints, especially constipation. Symptoms derived from medullary carcinoma of the thyroid. Symptoms derived from pyochoromytom, craniosynopsis, the ages of leaks of tears, delayed puberty. The video.
Hi friends, welcome to our channel Dr. Genius Academy of Medical Education. Before going to the mnemonic, a small note about the playlist we have created, in which we have all the videos in an organized way to make easy for you to follow and access videos. You will find nicely arranged playlists like high yield topics, individual subjects, image based questions, mnemonics, single liners, etc. For high yield topics, just see the description below every video for the list of topics so that you will find it easy to go through those topics which you are not familiar with. And coming to the mnemonics, I hope they will help you a lot for both MBBS students and PG aspirants. Now coming to this particular slide, MEN 3, multiple endocrine neoplasia 3, components of this MEN 3. So the mnemonic here is MEN 3 is a disease of 3 M's. MEN 3 is a disease of 3 M's. So first for medullary thyroid carcinoma, M, second M for medullo-of-adrenal, that is pheochromocytoma, third M for mucosal neuroma.
Yes.
So this mnemonic will help you in remembering MEN3 syndrome, MEN neoplasia. So in previous slide we have seen the mnemonic for MEN1. This topic of multiple endocrine neoplasia is very important. So please go through this complete table of this complete multiple endocrine neoplasia topic from our high yield topics. And this topic, questions from this particular topic have been asked numerous number of times in your entrance exams. So please be thorough with this particular topic.
Yes. Application in nurse. The variants in the red proto-encoded cause mean to be in recent decades, no case of meant to be, has seen report that lack such a variation. The IN9-1T variant alone is responsible for approximately 19% of cases. All gene I variants that cause mean to be are through the I chain is signed through the red protein, which is receptor molecularly found on the cell membranes. Those ligands are part of transforming growth factor beta signalization system. That was the bit.
To another mnemonic video. Today I have made 3 pictures to simplify different types of MEN syndrome or multiple endocrine neoplasia syndrome. In the very first picture you can see 3 men standing on 3 separate M. So MEN type 3 contains 3 M. First M is medullary thyroid carcinoma, second M is medulla of adrenal, which actually means tumor of the adrenal medulla, also called pheochromocytoma, and third one is mucosal neuroma. Come to the second picture. 2 men standing on separate M and there is a P instead of M. So MEN 2 contains 2 M and 1 P. 2 M are medullary thyroid carcinoma and pheochromocytoma, and P stands for parathyroid hyperplasia. Third picture is for MEN 1. One man standing on a P and holding 2P in his hands. So MEN 1 contains 3P. Pituitary tumor, pancreas tumors like insulinoma and gastrinoma, and parathyroid hyperplasia. That's all, guys.
Yes.
Hey guys, welcome to
The uses in Ecuador. A variety of eponyms have been processed for mean to be such as William Pollock syndrome, Gollier-Bricker syndrome, and Wagner-Frobe syndrome or Weber. None ever gained sufficient traction to merit continued use, and they are no longer used in the medical literature. The prevalence of mean to be is not well established, but has been derived from other epidemiological considerations as 1 in 6 billion to 1 in 4 billion. The annual incidence has been estimated at 4 billion with year. That was the video.
Endocrine neoplasia is a rare genetic disorder in which patients are predisposed to developing endocrine tumors. There are 3 types of MEN disorders: MEN1, MEN2A, and MEN2B. In MEN1, the most common organs involved are the 3 Ps: parathyroid, pancreas, and pituitary. In MEN2A, the 3 most common manifestations are the 1M and 2 Ps. First, medullary thyroid carcinoma. This is seen in almost 100% of patients. It is associated with foci of C-cell hyperplasia and is aggressive. Next, pheochromocytoma, which is seen in 40 to 50% of patients, is often bilateral and may be extra-adrenal. And lastly, parathyroid hyperplasia. This is seen in 10 to 20% of patients and may present with hypercalcemia and renal stones. To read more, see Robbins' 9th edition, page 1137.
Yes. In conclusion, the eye testing is now the preferred method of establishing a diagnosis for men to be and is thought to be almost 20% sensitive and specific. Goron et al. Report cause of a different disease, the multiple mucosal neurona syndrome, having the physical phenotype was meant to be, but was variation in the red gene and without malignant. The video.
Hi guys, this is Dr. Javed, and let us simplify the topic of multiple endocrine neoplasia syndrome, that is MEN syndrome. How to remember it easily and how to simplify the different types of manifestations. So the basic thing to remember is MEN. So as an Indian, I feel like MEN in blue is Indian cricket team. So the number of men are 11, the chromosome number is 11, and the dominant. So it is an autosomal dominant inherited disorder and it is present on the 11th chromosome. And there is another variant of MEN syndrome, that is MEN2, wherein remember that one player is injured and the number of players are 10. So the MEN2 is situated on the 10th chromosome. MEN1, MEN in blue, the gene is menin, MENIN. So the components can be remembered in a simple way. MEN1 constitutes of 3 Ps, that is pituitary, parathyroid and pancreatic hyperplasia. Coming to MEN2A, it is 2 Ps and 1 M, that is parathyroid hyperplasia, pheochromocytoma and medullary carcinoma of thyroid. Coming to MEN2B, you have all the M's, that is M. One is medullary carcinoma of thyroid, one is mucocutaneous ganglioneuromas, third is marfanoid habitus. So this is a simplified way of remembering things and hope so you don't get confused with this. Thank you.
Please like.
Thank you, Mr.